Welcome to today's episode of Normalize This Shit. I'm here with Dr. Euodia Chua, who's a licensed clinical and disaster psychologist, specializing in trauma, traumatic stress reactions, and issues regarding diversity and inclusion. Dr. Chua is currently the mental health advocate for the Asian Pacific American Student Association at the University of Arizona. She provides psychoeducational and clinical services to the APASA students and staff. Dr. Chua provides a cultural lens to encourage exploration of identity in the self, to process experiences, and to promote psychological well-being. She is also the co-founder of True North Psychological Services, LLC, a private practice psychotherapy group in Tucson, Arizona. And, of course, she is my wife and the mother of my children. Welcome, Dr. Chua.
Thank you for having me on.
So can you tell our listeners a little bit about what disaster psychology is? I mean, I think people know what clinical is or have his grasp of it. What's the specialization of clinical and disaster psychology?
Yeah, for sure. So I kind of think of the clinical work as more day-to-day work. You know, we see individuals maybe presenting with like depressive symptoms or sometimes with anxiety, adjustment disorders, right? Or adjustment symptoms. And if you think about clinical work as helping people improve their day-to-day lives and day-to-day functioning, then I think of disasters as really seeing people in typically the worst case scenarios, that the most sometimes challenging times of their lives. And so we get to go in as disaster psychologists, either on a broader level to help with the response and planning of responses, or we go in, you know, to do a little bit more of like the one-on-one response on ground as well.
So very specialized.
It really is. And I think it's such a privilege that you and I got to attend that program together.
Right.
And we
I was there.
Yeah. And we got to really have this training where we can meet people in their time of need and help communities and families or individuals during some of the most difficult periods of their lives.
Yeah, and for our listeners having questions about that, you can look up the Disaster Mental Health Institute at the University of South Dakota. Mm-hmm. Dr. Chua and I trained under Dr. Jerry Jacobs and Dr. Randall Quevelin, Dr. Beth Boyd, mm-hmm. who are the fundamental founders of disaster mental health.
Yeah.
I think you are probably the most perfect person to talk about the topic today, and I'm emotional reactions, normalizing emotional reactions. Uh-huh. Can you tell me a little bit about why you want to talk about it? I mean, I have an idea of why I am excited about this topic, but I'd like to hear your thoughts first.
Yeah, and I can't wait to hear what you have to say about it. But yeah, I think especially in our practice, or let me speak for myself. In my practice, I see a lot of individuals come in and what they tell me is, can you help me fix this? Why am I feeling this emotion? I don't like it. I don't want it. Shut it down for me. Like, teach me how to not feel this. And I think both in my personal but also professional life, I see how important emotions are, how important emotional reactions are to normalize, just because they tell us so much about our human experience. They give us so much information about ourselves, the people we interact with, and also what we're experiencing in the moment. If we shut that down, we miss a crucial part of what it means to be human. And so I was hoping, mm-hmm. maybe we could talk a little bit about instead of seeing intense emotions, strong emotions as something to avoid, something to shut down, we can start to see them as a really core part of being human, of being alive.
Yeah, I think that you put that very beautifully. Not just because you're my wife. No, that was very beautiful.
Thank you.
Sometimes I think that a lot of our patients think that having a negative emotion is bad.
Yeah.
That there's something I have to fix that. Mm-hmm. I'm feeling sadness at this reaction. I'm feeling guilt. And rather than seeing it as this is information, this is natural, mm-hmm. oftentimes, and I'm using our patients as a reflection of the world, is they see I'm only supposed to have positive emotions. Those are the things that
Yes.
are good for me.
Right.
And negative emotions are bad for me.
Exactly. And I think you were mentioning like patience, but even on a personal level, you and I have talked about this, what it's like to be able to come to acceptance of painful experiences, of things that are non-neutral, non-positive, because those are always, I think, like maybe as we're growing up, as we're socialized, we often say, I want happiness in my life. I want smooth, like easy, right? And the thing is, I don't know, maybe it's a function of growing older. I'm like, but some of the most edifying and invoking experiences are the ones that are difficult as well. And instead of fighting those, if we allow ourselves to experience whatever comes up for ourselves, then we get to know ourselves too on a deeper level. We don't fight who we are or what we experience as a result of these difficult times.
Well, and when you said that, the first thought I have is if we're avoiding negative emotions, then we are avoiding a part of ourselves.
Yes.
We're not paying attention to, neglecting
yes.
a part of ourselves.
Right. Or even maybe actively rejecting too sometimes.
Yes. I shouldn't be
right.
feeling this way.
Yeah.
How often have our clients said that?
Right.
I mean, I've said that too. I shouldn't be feeling this way. Like,
right.
why am I feeling this way?
Exactly. Yeah, I totally relate to that. I find myself having to catch not saying that to our son as well, right? Like, I don't need to shut it down, or I feel the need to shut it down. Why do I feel the need to shut it down? Maybe I don't. Can I let him have his reaction? Can I let myself have my reaction and not like push that away, or not feel like I'm shutting down from it?
It makes me think of that. It's probably a whole separate topic, but reactions as a parent, right?
Oh, hey, episode 8.
Yeah, I mean, trying to normalize as a parent, like your frustration, or you're feeling sad for a moment. That why am I feeling sad about this?
Exactly.
Exactly. Even though your child may not be reacting that way.
Exactly. Yeah.
Yeah. What do you think from your experience with clients? What are the most prominent emotions that you find that they say I shouldn't be reacting this way? Or is it a why am I not happy? Is it why am I feeling guilty for you know what I mean? Like what a spectrum.
I think it's so wide. Anything that is not categorized as positive.
Right.
I tend to see people like either have a reaction to it and be like, I need to shut this down, or I'm not allowed to feel this. Or sometimes it's like immense anger at themselves for feeling that way, right? And it's interesting because with some clients, when we explore and I ask them, oh, what makes you feel like you don't have permission to feel this way? Makes you feel like you need to shut it down? For them, it's like internal, where they're like, well, I don't deserve to have the space to feel this. Sometimes it's not. Sometimes maybe they've gotten that message from someone else, like a caregiver or someone in their lives that maybe they looked up to, or that they felt safe with or were attached to, who gave them that message, right? Of you shouldn't feel this way, or you're not allowed to have this reaction. And so then we learn to then shut those emotions down. Right.
I often find that there's two camps there's individuals that they have, in the classic sense, an abusive, parent or that teaches them to shut down emotions. Or you have the case of parents themselves are emotionally unstable and place a lot of the burden and dependency upon the child, and then therefore they think to themselves, my emotions don't matter,
Right.
my needs don't matter, they need to be on the shelf because I gotta serve or take care.
Right.
It's like, and both of them kind of be summed up of, I don't deserve to feel this.
Yes. Yes.
Right.
And I think sometimes it's not even like, I think those two camps that you talked about are pretty, I would even say they're pretty extreme camps, right? You even have like parents who maybe, well, because I would say even our understanding of emotions in our field has changed over time, right? It's gone from, oh, let's focus on maybe more behavioral techniques to more cognitive techniques. And now we're like, oh, let's work on understanding feelings and not like overregulating it or taking it away, right? And I think parenting can reflect that too, where it's more neutral than maybe harmful in some ways. It's not abusive parenting, where sometimes parents don't understand their own emotions. They were never told you get to feel these emotions. So they're like, oh, what do I do with these? These are uncomfortable. And so now with their own kids, they're like, shut it down. It's uncomfortable.
Right. I think of every time, and some patients will tell me like, oh, my parents don't argue. I don't ever see them argue.
Yeah.
And they initially think that that's a great thing. And then you spend more time and then they find that they're having anger.
Right.
And they're not expressing their anger. And it's like, see, the modeling is very important. And I think the intergenerational idea that, sadly, I have to say my age. I'm going to be 34. So, the generation before that, my mom was born in 58. That generation is very different in addressing emotions and their concept of what emotional reactions should be versus us and then our kids.
Yeah.
Right?
I bet there are going to be things that our kids learn that we're going to have to learn too. And we don't have to learn, but what I mean is like, we're going to learn about it. And, it's up to us if we want to move with the times and integrate with them, right? Yeah. Or if we fight it.
I could see you moving with the times. I could see me fighting everything.
You don't give yourself enough credit.
Like a grumpy old man who just wants to
flexible
sit out on the porch and drink coffee. So you said a broad spectrum of it could be any emotion.
It really could be any emotion. The interesting thing, talk about different emotions, right? Like anger, sadness, despair, disappointment. I think those are the ones that I typically see people come in and they're like, why am I feeling this way? What's wrong? Why? Right? Or I don't know what to do about this. And then there are some, we talk about them as like secondary emotions, right? Shame, guilt. Those often, I think, are a function of like difficult experiences, pain or suffering that they've experienced. And those are a little bit more complex to work through, to navigate. Because I think often but in our training we learn, right, that often there is a cognitive step in between the primary emotion and these emotions of like shame or guilt, where maybe they're blaming themselves for something, right? There's something being internalized here. There's something that is, I would say, maybe more maladaptive in the way that they're viewing themselves or maybe the situation or the other person that is causing the shame or guilt to come up. Yeah. And I think often in those situations, being able to be curious about what's coming up for us is then like twofold, right? It's how can I walk through, how can I move through these emotions? And then the cognitive piece coming in too, right? Like threading those two together. What is that belief underlying it that is maybe bringing this complex emotion up for me?
you often see guilt come after a reaction of an emotional reaction. Something happens.
Mm-hmm.
I feel a certain way.
Yeah.
I shouldn't be feeling that way. That's
Right.
kind of the belief you have.
Yes.
And then the should ends up leading you to, okay, because I shouldn't be feeling this way.
Yeah.
And I do feel this way. Something's wrong with me.
Yes.
And now I feel guilty.
Yes.
Right? Like, and then oftentimes it's not guilt, it's internalized shame.
Yes,
right?
Exactly. Exactly.
Yeah. It's a very quick.
It is so quick. And unfortunately, it is so, it creates this loop, right? It's really hard to get out of it. And the moment you kind of step into that cycle, it's really hard to get out of the self-blame. This is directed at myself, right? So maybe I've already had a conflict with somebody or a disagreement, and now I'm leveling another layer of guilt in myself, right?
Right.
So then I'm like truly stuck now. I'm digging myself this really, like, I'm in this really deep trench of this is my fault.
Yeah.
Right.
I get the image of you're digging your own kind of grave type thing, like self-imposed
Right.
shame. Like you
Exactly.
you keep shoveling the dirt up.
But not because we want to.
No.
Right? Not because that's what we want for ourselves. And I think that's where a lot of, like, the third layer of shame comes in, right? Like, am I doing this to myself? Am I causing myself to get all wound up? And like, I hear this often, I'm overthinking this, or I'm overthinking this, Dr. Chua. I'm doing this to myself. And I'm like, no, these are things that we kind of pick up along the way, right?
Yeah.
We internalize these messages, or we find ourselves stuck, and then it's hard to work ourselves out of that. That's why going to therapy is helpful.
Right.
No, I'm plugging our
Yeah. Kind of.
our profession, but really it's hard to do it on our own.
Yeah. When you've been given the instruction booklet that says this is how I'm supposed to react to something.
Yes.
Right. And so then my life kind of happens and I start to have reactions that are not on that instruction booklet.
Yeah.
And I don't know that I can go off course and feel whatever I need to feel.
Exactly.
We always look back to that. Oh, this doesn't make sense. I'm supposed to feel this.
Yes.
It's in the instruction booklet.
Exactly.
And I don't feel that.
Exactly.
What's happening to me?
Right.
And I think as a general rule of thumb, most humans are very like, they ask what's wrong with me first versus like what is wrong with the situation, or maybe there's nothing wrong with the situation. There's nothing wrong with me. If there's something, if there's a dissonance, there automatically means that there's something wrong. And that is not true. You know, like that's not,
Right. And I think our minds try to create some sense of safety by categorizing it, right? Good, bad, right, wrong.
Yes.
Black or white, right?
Yeah.
And it's so fast that it's hard for us to tolerate the ambiguity.
Yes.
Right? And so then when we're left with like, oh, maybe this is uncomfortable or this is unfamiliar, it brings up feelings maybe of fear, of feeling unsettled, of that unfamiliarity, I think, is often mixed with, then it must be dangerous.
Yeah. And we talk about the concept of, you know, like in general dealing with major political issues in our society, like racism or something, like the concept of the other, right? But there's the other within ourselves, right? There's the unfamiliar of a reaction that we're having. Yeah. And that is sometimes just as frightening as an external kind of other.
Oh,
right?
I think often people experience it as even more frightening, to your point, because they're like, what if I look inside and I don't like what I see?
Yeah. There's a really dark, scary place. Right.
When it's simply unfamiliar, it's not dark or scary often, right? But then our minds kind of create that. I think it creates this fear, right, of like perceived danger when we don't know what to expect.
Yes, we make assumptions about. Yeah. It's a protection thing, right? Like we say our brains label it as unsafe.
Exactly.
Yeah. So is that what you recommend to your patients then, of like getting okay or being okay with the unfamiliar, that breaking the assumption that the unfamiliar is not supposed to be, at least emotionally,
Mm-hmm.
a scary thing. It's supposed to be a natural thing. That's how we're reacting to a situation,
Mm-hmm.
and it's okay however we're reacting to it. We don't need to be afraid of how we're reacting to something.
I think it's more that it's okay if you're not okay with it. It's okay whatever comes up for you, you know, that we learn. One of so my research area is resilience, right? And one of the key components, factors that predicts resilience is self-efficacy, right? If a person believes that they have the capability, if they trust themselves to navigate situations, whether it's internal or external, right? Circumstances, whatever comes up for them, right? Sensations, feelings, thoughts, right? If they trust that they can navigate it, right? It doesn't matter what comes up. The thing is, are there going to be difficult circumstances? Yes. Are they going to be unfamiliar, sometimes even dangerous circumstances that we're in? Yes. But do I trust that I can show up for myself in those situations and that I can get help in those situations? Then I don't, even if I'm fearful, right? I trust that I will show up for me. I trust that I will get help from people who love me, or people who are there like first responders for me, right? Then I think that brings that vigilance or hypervigilance of like the unfamiliar or the most feared. It kind of takes a little bit of that fear out. And it allows us to, we talk about tunnel vision. So then the tunnel vision opens up and I can be curious instead about what's coming up for me.
Trust, you said, and I think there's oftentimes a very fluid line, or a fluid relationship between trust and feeling you're capable.
Yeah.
Right? And I think a lot of people think that being capable means I have to have the ability to solve this situation.
Ooh, yes.
With no matter what.
Yeah.
And that's their concept of capability, when really what we're talking about, and I try to correct them of like,
yeah,
we're not, capability is in like going deeper and saying trusting that whatever comes,
yeah,
even though that may not be like capable of like, okay, I'm not trained for that specific thing that is happening to me. I trust that I will be able to handle the emotions that come with it and be able to get help.
Yes.
Right?
Yeah.
Versus seeing yourself as I have to be capable all the time.
Yes.
Of being vigilant. That's the vigilance.
Exactly.
I'm capable. You know what I mean?
Right. Which is like I think the idea, I'm saying this with air quotes, right, of being strong, right? It means I must be able to tackle every one of these. And when really sometimes I talk about like heartbreak or really, really overwhelming emotions, right? And sometimes I can't navigate it on my own. And strength is in saying, like, to my partner, right? To a friend, a dear friend, to my therapist, like, I can't. This is so much. This is so difficult. And to let them come alongside us and say, let me hold you. Let me be here with you. I think there's so much strength in that, right? And if we can teach ourselves and our children, it's okay. It's okay to let your heart break. It's okay to experience these emotions. This is a part of the human condition.
I think there's a lot of fear around accepting that that's a part of the human condition. Heartbreak, suffering.
Right.
Things like, for example, Russia and Ukraine happening.
Yes.
And that there's horrible things happen, and that's not just globally, but every day people have things that are extremely painful. You lose a job, you're getting divorced.
Yeah.
and that is, I can't allow that in.
Of course.
I can't let that in.
Right.
And, you know, there's a time for not letting it in, right? We talk about this in therapy of like, if you're in the midst of,
right.
you know, like, for example, if you're ongoing divorce and you still live with that partner,
Yes.
functionality is the best thing. You just got to get day to day.
Yes. You're in the midst of a war and you're trying to evacuate, right?
Right.
Let's not be processing emotions right now,
Yeah,
right?
we're not
Let's get you out of there.
Yeah. The goal is to just get you out of there.
Right.
But then when you get out of there, a lot of people, and you know, this is our next episode on trauma, but
yeah.
a lot of people are unable to get past that survival point.
Yeah.
Emotionally and get to the process and heal.
Yes.
And step one is kind of letting that in.
Yeah.
But that's a scary thing. It's like,
100%.
The visual is kind of letting the minotaur in the door.
Yep.
You know, like you're letting this huge beast of a thing come at you. Because you fear it so much.
Of course.
But there's only one way of dealing with the beast, and that's you gotta be there with it, not confront it in the sense of like I gotta beat this thing
fight it
down.
or
No, it's letting it be there.
Right. Yeah. And I think it makes sense that, you know, generationally it's difficult to model that for our children. I don't know if you feel the same way, but I feel like it's really difficult because I want to save. I feel like my reflex is I want to save anyone I love from any pain or suffering and heartbreak, right? I'm like, I don't want my son to cry. I don't want him to experience, you know, feeling rejected by somebody, feeling fearful, anxious about them. But the reality is that will be a part of his life. And we can either, I guess, fight it and be like, I protect you from everything and shelter you from everything. Or I can be there with you and show you, sometimes mom is scared, right? Sometimes mom's heart breaks when your heart breaks. Yeah. But I will be here for you, right? And I think that's really powerful and connecting for human beings, that we not operate just out of a fear response.
You said something there that powerful and connecting to human beings, and that leads me to be thinking like having emotional reactions and normalizing, like letting them be there is a way and to be human. Yeah. It's a way as a part of connecting with one another and feeling a part of humanity. Yeah. Right? When we do the opposite, we disconnect from humanity. Yes. We disconnect from the humans around us. Yes. And you even see that in, you know, I made that joke about sitting on the porch, right? Yeah. But that's what my grandfather used to do, right? He disconnected from all his emotions. He served in the Korean War, and he used to sit outside all, you know, for hours. Yeah. Not being a part of it in his own kind of, I'm sure, probably stuff that he didn't want to deal with. He probably took 6 cups of coffee. He was up at 4 a.m. and just kept drinking coffee. But that's the archetypal image of the disconnect. Yeah. Is that, you know, from a man, like from a guy's perspective, is like, you know, the disconnect, a man on the porch. Absolutely. Completely not in touch with his emotions at all. Maybe except for anger, right? And, you know, the expression of anger and then maybe the expression of sex. That's about it. But, you know, I don't even think my grandpa ever said he was sad. I don't think that ever came out of his mouth. Okay. You know, like I don't think that I'm feeling guilty never came out of, right. You know, I'm feeling worried, that never came out of his mouth. Right. You know, and that's a weird thing growing up and seeing. Yeah. And it's so funny that you say that because, you know, I've worked with some clients who in the beginning when we start working together and I, you know, usually when we're starting, I kind of prompt a little bit and ask them, oh, are you feeling something? And if they're like, I don't know, I ask, you know, could you maybe be feeling a little sad about this or a little upset? And sometimes I have clients who said to me,
can I say that?
Mm-hmm.
Like, am I like they're asking me, am I allowed to be sad? Am I allowed to say that I am really sad and hurt about this? And I'm like, yes, you know, but like that, the social rules around it for some reason seem, I think, really rigid, really firm. Like, no, you're not allowed to feel this way. You're not allowed to say that, because somehow maybe it's a reflection of this relationship that's very precious to you, that's really, you know, meaningful to you. And saying that I feel hurt when my friend did this to me or when my family member did this to me somehow then becomes a reflection of like it takes away from that relationship.
It detracts.
Exactly. Or that I'm criticizing that, rather than, no, there are ups and downs in all relationships. There are periods of stability, and then there are periods of trial. Yeah. Right. And that instead of us seeing it as like, oh my goodness, that's like, maybe that's so unhealthy, and that means it's like a huge signal for a problem, we can say, oh, I wonder what's bringing this up? What is going on between this person and myself that is bringing these feelings up for me? Mm-hmm. I can allow myself to feel these.
Switching from judgment to curiosity.
Yeah,
right?
Exactly. Yeah.
Yeah,
exactly.
From the therapy perspective, you know, the Columbo technique, right? Like, yeah. But I always give that example of being curious, that, 1970s Columbo show, where Detective Columbo, he's like, wonder what's going on here. You know what I mean? Like the idea of, I'm an emotional detective. My job is not to make a judgment too early. Yeah. It's to follow the clues of what's happening to me.
Exactly.
And to determine what's going on.
Yes.
Versus like, well, that's not how I'm supposed to be feeling. Or,
right.
This doesn't make sense. What's wrong?
Right.
It's like, okay, it doesn't make sense. Right.
Mm-hmm.
And tone is really important.
Yeah.
Okay, it doesn't make sense.
Mm-hmm.
That's all right.
Yeah.
It's all right. It doesn't make sense.
Yeah.
I'll just follow the clues wherever this goes.
Yeah.
And whatever's at the end of it, it'll be okay.
Yes. I'll figure it out.
Yeah, I'll figure it out. That trusting.
Yeah, exactly. Right. Or I will feel what I feel, and then we'll go from there.
Yeah.
Right.
Do you think people, I guess what is your experience with people thinking that is quote unquote cheesy? I feel what I feel, because I deal with a lot of male patients. Men,
yeah.
And I try to get them to like, I try to use metaphors of that are more quote unquote traditionally masculine to get them to hop on board with the idea of being the emotional detective, right? That's a, very traditional, okay, I can be a detective, right? But what is your experience with that?
Well, when I work with adolescents, they'll be like, yeah, this is so cringe.
Super sass.
This is so cringe. Are you really making me do this?
Oh my gosh, Dr. Chua, are you serious?
Exactly. If clients come in and they're like guns blazing at me, like, this is cheesy, I don't want to do it. Mm-hmm. Then we do a little bit more exploration. Oh, why is that coming up for you? Why is this reaction coming up for you?
Yeah.
Right? Versus, okay, you know what? Like, I'll try it. Sure, it's a little cheesy, right? Yeah. And most of the time when they do it, they'll tell me, actually, it's like way more difficult than I've imagined.
Right. I think, okay, I'm glad you mentioned that, because that's the thing is, when you get them to that point, then they say it's a lot harder.
Yes.
Right. It's actually work. I think people, and I tell this to everyone I meet if they ask me about therapy, and I usually lie about my profession, right? But if it ends up coming out that you figure out I'm a therapist, people traditionally think that therapy isn't work, but it is emotional work.
Oh my goodness.
You're constantly in session if you're with a good therapist.
Yeah.
And that's a topic for another time.
Yeah.
But the idea of you should feel uncomfortable. Mm-hmm. It's a tough thing to be.
Oh, for sure.
Talking about emotions and changing how you view yourself.
Yeah.
That's really hard to do.
Of course, it requires so much vulnerability.
Yes.
Like the willingness to be open to, well, first of all, the fact that maybe I'm speaking for myself now, right?
Mm-hmm.
Like as like on a personal level, that I'm not right.
Yeah.
And I'm not like, I'm not my best.
Yeah. I'm not the best.
Right. And I'm trying to be, I'm hearing feedback from another person. I'm hearing their take on something. And my willingness to listen to that, to really apply it. I think that's.
You know what's interesting about that?
Yeah.
Is that, you talk about like the concept of being the best and, being right.
Mm-hmm.
I never get that sense of you putting that pressure on yourself as a therapist. Like you're always, every time that, I've seen you, if we watch video or whatever, in graduate school, you're fully with the person. You're not focused on, am I doing this the right way or you know what I mean? Am I asking the best question for this person at this time? That actually detracts from
Right.
You're never like that on.
Oh,
I've never seen you like that. Ever.
I really hope that's what my clients feel, because that's.
No, I think that's a testament, because they keep coming back. I mean, they ask for you all the time.
And yours asks for you all the time. You have some really loyal.
I have them adolescents be like, I want to see that Dr. Moffitt guy.
Hey, you're not cringe. Okay,
Yeah,
that's
I'm not,
bid deal
I'm not
here.
Cringe. Not cringe. I just had to explain an Outer Limits joke to some 19-year-old, and I was like, oh my gosh, I'm starting to sound very old. For listeners listening, Outer Limits is a very old show that was running on the Sci-Fi Channel.
And I meant like, when I said like wanting to be the best and going in, I meant like therapy for myself, on a personal level. Like, I think sometimes if I find myself fighting something that my own therapist is telling me, I have to ask myself, like, where am I coming from? What do I feel insecure about?
Oh, okay.
Yeah.
So is it the traditional, like not traditional, but like the stereotypical, the best version of me? Is that what you're talking about?
Yep.
Okay.
Exactly.
Yeah. I thought you were meaning like there's got to be the best way or the right way to do this, or
and you're totally right. Like as a therapist, the moment I feel that, right, I have to remind myself, I'm not here to quote unquote be the best.
Yeah.
I'm here to show up for this person. How can I do that in the most supportive, affirming way? Yeah.
The irony is graduate school kind of teaches you the opposite. I don't mean to rag on graduate school, but graduate school is rigorous.
It is, because I think
It's
you're trying to learn. Yeah.
Rigorous. You get a lot of material, you get a lot of protocols, and there's a lot of questions of like, am I doing this right?
Right. And when we're learning something new, like any skill, right?
Yeah.
I think that's required. That's important. And then you get, I mean, I still consider us pretty early career professionals.
Not judging by the wrinkles on my face.
True. Fair point. That could also be from having
I've been
children.
practicing for 85 years.
But I think as we go along and we become a little bit more well-versed in the techniques, then we can really focus on the relationship that we're building with our clients, on sitting with them, on being present with them. I think that comes with like a little bit of time and a little bit of, a little bit more experience. Or maybe I'm wrong. Maybe I'm like...
You lose the worry of always, is this according to the protocol? Is this part of this manual or not?
Exactly.
What would this guru say about what I'm saying?
Yes.
Right. Oh, it did. It didn't line up exactly with what I was looking for. What? Like you say, people that are not, besides going to therapy, what recommendations would you have for people to kind of normalize their experience
with emotions?
Yeah. I mean, we probably talked about some of it already, but Yeah.
right? Asking ourselves what's seemingly cheesy or simple questions, like what's coming up for me?
Mm-hmm.
Why might I be feeling this way? Right? How can I take care of myself if I feel this way? Right? Sometimes instead of doing, right, how can I be with myself as I feel this? I find myself fighting that a lot, like just personally.
Personally?
Yeah. Like if I have a difficult emotion, sometimes I'm like, well, I'm really fighting through this. I really do not want to feel angry. I don't want to feel this. Why am I feeling this way? And letting that process be there. Right? And then being like, wow, maybe under the anger or under the fighting is a lot of sadness. It's a lot of hurt. Or it's a lot of disappointment, right? Whether it's with myself or with somebody else, towards somebody else rather, right? And then being able to process that. You know, sometimes we process it on our own, right? I think through things, right? I let myself feel what that's like, right? Sometimes it's with a loved one, right? Like I come to you and I'm like, oh, I'm having a really hard time with this, or sometimes you point out to me, you're like, wow, you are having a really hard time with this. Do you want to talk about it? And I fight you first. And then after I'm like, yes, I really want to talk about it. Right? Or sometimes it's like doing things that's healing for us. Right? Being in the garden is healing for me. Listening to certain songs. Right? Spending time in reflection or in quietness, right? Different things for different people. Some people love art, right? Expressive, creative expressions, right? What about for you? Like, what do you do with these emotions then?
Well, you mentioned that you fight them, right? Sometimes I'm not even aware of them, right? Like that's my issue because I'm not aware.
Yeah.
And I think it's only like post hoc that I find, like, you know, the times that I'm like, usually I'll go to bed at 1 or 2. If I find myself playing video games or reading till 2 or 3, I'd like, okay, what's going on for me?
Okay.
Right? It's like that's when it hits me of like,
Yeah.
I'm not doing the thing that I normally do.
Right.
I'm catching myself, you know, I've played video games for like, you know, like when our sun goes down, you know, if I'm immediately like, okay, I'm going to go play video games and then I don't stop.
Yeah.
That's my kind of clue.
Okay.
Right? Like it's those things where it's my behavior dictates my awareness into, okay, something's happened for me in the last week. What am I stressed about? What am I feeling? And that's how I'd like to get to the place where I'm more aware in the moment of what's happening. But sometimes I get so overwhelmed. Right?
Yeah.
And then it's afterwards that I'm like, okay, I've been playing video games for the last couple of days a lot, right? And
it's kind of your process, right?
Right, and you'll even say to me, "Hey, hun, like, do you know, come spend time out on the couch. Like, have you noticed that you've been?"
Yeah.
I'll be like, "Oh,
exactly.
yeah." Like it's. I think it's another important thing too is having people around you.
Yes,
social
reflect
support.
to us. Yeah.
Hey, are you doing all right? Is that, you know, you seem off or different this week?
Yeah, absolutely.
Right? That's a huge clue.
Yeah.
If you're by yourself, you got to be, I'd say, diligent about noticing the changes in your life, and how you're acting and how you respond.
Yeah.
If all of a sudden you want to go downtown and party for no reason, and you're not a usual you're usually a homebody, and now all of a sudden you want to go out, what is that telling you about the situation? I mean, that's a pretty plain, open, easy example, but yeah, I think for me it's more the becoming more aware and noticing my behavior afterwards. Yeah.
What is healing for you? What have you found is healing for you? I'm curious to hear that.
Good question. Writing. Probably.
Okay.
Probably writing.
Yeah.
I think I've been doing it so long at this point. It's part of my way to calm down. It's part of a way to process. Listening to music, talking to you. But I'm not much of a talker, though. I mean, you know that, right?
The irony, you're
I know.
making a podcast.
I know. I know. But talking about me,
Yeah.
right? Like I can talk about topics.
Yeah.
I don't talk about me, though. Like, see, you asked me that question that I don't know. Right? What is healing for you? I had to think about it.
Yeah.
Yeah, I would say writing.
Okay.
I would say spending time with you, and if Magnus is in a good mood, spending time with our son. When he's in the grumpy cat mood, that's a little bit different. Family time, doing things as a family is very healing. It gets me away from. It reminds me of what's important.
Yeah. Same. And friends. Dear friends.
Yeah. Doing dinner and laughing and.
I love that. Yeah.
That's a fun
that
thing.
sense of
Human
connection.
things. Right?
Yes.
Human things.
Yes, exactly.
Yeah, connecting as humans, I think, is the thing. But yeah, I'll have to think of more about that because I really haven't put much thought. I just do, right? Whatever my mind is directing me to do, I do.
Yeah.
And it's only after I look back, I'm like, wow, you must have been really stressed that week, Matt. Yeah, you finished a 80-hour game in 3 weeks. Or I just really liked it. But thank you so much for coming on.
Oh, my pleasure. Thank you for having me
You
on.
were wonderful, as always.
Thank you. And you're a wonderful host. I really hope your series goes well. And I'm sure, it sounds like you're being very thoughtful in the topics that you're picking. So
thank you.
I'm excited to listen into.
Yeah, thank you. Thank you so much, hon.
Yeah.
Some people thought we were going to argue for an hour.
Oh, by some people, did you mean us?
Yeah, we thought we were going to argue for an hour. This is just going to be us bickering about the dishes or something for an hour. I'm sure people would love to listen to that. Well, thank you so much, Dr. Chua, and I'd love to have you on again.
Thank you.